Thanks so much, everyone, for joining Origin and Maude for our event on the pelvic floor, or the pelvic floorgasm. I know for so many women, myself included, pelvic floor can feel like a bit of a black box, and there's a ton of experimentation and trial and error that goes into figuring out orgasm as well. I mean, like, just personally, all through my 20s, I thought I was like, something was wrong with me because I didn't orgasm from penetrative sex. And I was like, what's going on? How does this all work? So hopefully we'll be able to help you better understand just kind of what's going on in your body and your pelvic floor during arousal into orgasm, and then help you leverage your pelvic floor to make that orgasm even better. And we're really excited to partner with Maude, Dr. Jen Conti here from Maude. It's a Latina-founded modern sexual wellness company. I personally own both their vibrator and their lube, and I can attest to how incredible their products are. I often give their vibrator as like a housewarming gift to people, so it's incredible. A quick reminder, we are recording the session, so like I said, we'll share it out with everyone after. And this is not medical advice, so just want to flag that. So if you have questions or follow-up from this, one, talk to your provider, or two, you can obviously book an appointment with Origin to talk about anything pelvic floor related. We also got a bunch of questions from the audience in advance, so we'll kind of sprinkle those throughout the conversation, but also leave time at the end for Q&A. And if anything comes up, feel free to drop it in the chat or in the Q&A box, and we'll try to address that real time. So to kick things off, I am Allison. I lead the marketing team here at Origin. We are a women's health company focused on pelvic floor and full body physical therapy, really focused on making this kind of care accessible to the 40 million women who suffer from pelvic floor dysfunction every year. And really excited to also partner here with Maude. Like I said, they are really focused on modern sexual wellness. So that's everything from, creating really like beautiful, quality, simple products, but also really focused on inclusivity and improving intimacy kind of across the board. So with that, I'll introduce our panelists. So today we have Dr. Ashley Rollins from Origin. She's a physical therapist and leads our virtual team in Texas. So she's in Colorado right now, just kind of all over the map. She really focuses on pelvic pain, sexual dysfunction, and then anything related to kind of pregnancy and postpartum, or bladder and bowel as well, the whole ball of wax. And then from Maude, we have Dr. Jen Conti. She's an internationally recognized health expert, medical journalist, and OBGYN, the triple threat, as it were. And she wrote the Vagina book, which is an incredible book about taking care of your vagina and everything going on down there. And she's an advisor for Maude, so we'll be kind of our expert as it relates to their products and that kind of OB perspective as we talk about the pelvic floor and arousal and orgasm. So with that, I will turn it over to Ashley to kick things off and kind of walk us through everything.
Thank you, Allison. And thank you, everyone, for joining us again here today. Again, I'm Ashley Rollins. I'm a physical therapist at Origin. And we want to kind of talk all about the pelvic floor, what it is, how it can contribute to sexual function and sexual dysfunction, and then ways for you to kind of help balance everything in order to optimize pleasure. We'll kind of talk a little bit about tools for maximizing pleasure, and then hopefully also address your questions that came in advance, weave them in as we go, but also drop them in the chat if they come up along the way. So the basic anatomy of the pelvic floor, kind of the basics of where to start. What are we talking about when we're talking about the pelvic floor? So it's this group of muscles at the bottom of our pelvis. We have our ring of bones that make up our pelvis, and they run from the pubic bone to the tailbone and kind of left and right between the sit bones. So they form this basket or hammock of muscles that help to hold up our pelvic organs and help to maintain their functions. So the 5 main functions of the pelvic floor include support, so they hold up the pelvic organs against gravity. They squeeze and close the pelvic openings to help contribute to continence. They squeeze the urethra, the anus, so that you don't have leakage of stool or urine. They provide stability to the pelvic joint with the pelvic ring. There's the pubic symphysis in the front, the sacroiliac joints in the back, and these muscles really help to tense and stabilize and provide stability and movement in this area of our body. They also are really important in sexual function, and it's why we're here today. But they contribute to erection, pleasure, orgasm, but they can also contribute to pain and dysfunction. And then they pump blood and lymph. They kind of act like all of the muscles in our body, which helps to improve circulation, but the pelvic floor is really effective in the abdominal and pelvic area. So how do they work? Again, they run from that pubic bone to the tailbone, and they have openings in which the urethra, the vagina, and the anus travel through these muscles. So when we squeeze or tense or contract our muscles, they squeeze and lift squeeze on the openings and lift up the pelvic organs. This is really important for continence, so to prevent leakage, to keep everything where it needs to be until it's the appropriate time to empty. And they also release and lengthen. And this is necessary for pain-free sex, right? If these muscles are contracted and tightened, then when you go to release them or stretch them for penetration or move them for sexual function, then it can be painful. And then you can also open and bear down further. This is almost like the extension and opening point of that muscle, which is really helpful in having a bowel movement and, of course, necessary for delivering a baby. They work together with your abdominals, your hip muscles, your core. It's all good, and diaphragm. So they're a really important part and member of the core working together. So how does it contribute to orgasm? Well, first, it's hard to talk about orgasm in your pelvic floor without first talking about the sexual response. And it is complex, which I'm sure you can agree, Dr. Jen. The female sexual response is complex. The sexual response in general, but particularly the female sexual response. And there's so much that contributes. There's emotional factors, there's physical factors, there's hormonal influences. And everything kind of has to have this dance rhythm to it, and they work together to provide what is sometimes known as a neurovascular phenomenon, that is orgasm. So there's many different theories on this and how it exists, and there's on the cycle of the female sexual response. So who, what, when, where, kind of how it happens. It takes, however it does occur. There could be one progressive buildup. There may be little mini buildups and hills and valleys, but however it does occur, you need intact nerve function, good blood flow, muscles that work together to help to support this cascade of orgasmic events. So what is contributing to the orgasm? Well, we all know about the clitoris. We have some pictures over here on the right of the screen. But when we say women get erections too, but it's not kind of in that same kind of typical sense that you are talking about when you maybe think more about the male anatomy. But there is erectile tissue in our pelvic area that, when engorged with blood, can contribute to sexual function. So what is happening during the sexual response? The vagina has lots and lots of blood flow that gets to those tissues. That massive increase in blood flow helps to lengthen and open the vaginal tissues. It helps to improve blood flow and lubrication to the tissues. It kind of helps to push out the lubrication. That also comes from the glands at the vaginal opening, as well the vaginal epithelium. So that's the skin or the tissue on the inside of the vaginal tube. And then as well as lubrication that comes from the cervix. Then we also have, of course, the kind of the OG of orgasm makers, the clitoris. Blood flow is almost doubled to this area. So blood flow really helps to engorge the tissues. Swelling, pressure, and growth can contribute to function in this gland. And when those tissues engorge, the head or the glands of the clitoris is exposed for their ability to have more sensitivity and stimulation to that area. Other changes that occur is that the labia minora swells, the tissues fold out, kind of expose more excited nerve endings, and the vestibular bolts, which, well, you probably can't see my my mouth. But on the kind of like the wings on the side on the clitoris on the side, that looks like the wishbone pieces, are located right under the labia. Arousal causes swelling to this area and then increases about 2 to 3 times its size.
And
Anything you want to add? Okay.
No, I was just saying, I know we got a question too, like, does your bladder, is like your bladder involved in orgasm or like arousal, or like, is that a myth? Like, I know like people talk about like, oh, I either have to pee sometimes, or like if I have to pee, I like can't get aroused, sort of. I know someone asked about that in advance, so I'm curious what the connection is around that piece too.
Yeah, Dr. Jen, I'd love some insight on that.
Hi, sorry. That you have, sorry, my stereo is talking to me. It's probably that you have a complex innervation of that clitoris, complex innervation of nerves to the clitoris, and it's also nearby the bladder. So everything, as you can imagine, like we're showing you pictures of it all. It's really close proximity. So literally right above the vagina is the bladder. Oh. Can you hear me now?
Yep. Oh, but you just
okay. Yep.
Well, so what I think she's kind of explaining is the anatomy of the clitoris and the urethra and the vagina. Everything is really kind of right all up in there. The location of the bladder is right up above your pubic bone. At the you can feel it through the top of the vagina, and the clitoris kind of comes up and snugs right around the urethra. So during penetration, during clitoral stimulation, all of those nerves kind of help to charge up the whole area. There's rubbing to the urethra and the clitoral area that really kind of help to, and they're all innervated, which helps to kind of contribute to the female sexual response. I think you are back though.
Yeah, I think you look good.
Yes.
Yeah.
We were 2 years into this pandemic and still figuring out all the Zoom stuff.
Totally.
This is exactly right, Ashley. That's what I was saying, essentially, that it's just really close by. Am I frozen again?
No.
Yeah,
No? Okay. Oh, just the nerves going to the clitoris in particular, it's such a complex network of nerves, and it's so close to everything else that it's really hard to separate out why you're feeling each thing individually, because it's all working together as sort of a complex environment, if you will.
Yeah. Oops, I think I just missed one. Oh no, that was it. Oh, and Ashley, you're muted.
I
Y'all, we will do this. But so the response of the pelvic floor, we talked about the female sexual response, what kind of happens with some of the organs, their changes during arousal. The pelvic floor may also contribute. Now, at the same, what can be frustrating is that while there is, some evidence surrounding the actual details about what exactly goes on during sexual function, which you can imagine is probably a harder thing to study, for sexual function to be normal while you're being studied. But we do know that the pelvic floor is extremely important in sexual function. In pelvic health in general, sexual function being a really important part. During arousal, your pelvic floor muscles can actively contract. So you're kind of consciously using them to help improve blood flow to the nerves, to the tissues. Remember, these muscles are important for pumping and circulation. So engaging and relaxing, which is a really important part, not just contracting, but also relaxing, can help to improve the blood flow to these tissues. And it may because of that increased blood flow and nerve stimulation and response, can increase your sexual pleasure. The superficial muscles of the pelvic floor can facilitate engorgement as well. So there's a couple of layers of pelvic floor. The most superficial ones, which is just right underneath the skin of the vulva, can really help to contribute to engorgement by compressing the blood vessels. So blood flow travels into this area, and that kind of compresses the superficial muscles when we're contracting and holding tone, will compress those blood vessels and kind of keep the blood where we want it to stay. And then
that was my most like eye-opening moment, was like, oh, I'm like contracting all this time. Like, oh, you actually have to practice like the contraction and release piece of it.
Yeah. And the release piece is kind of the most important, right? That it is important to have, when we think about strength and functioning muscles, we think about just like strong muscles. A strong muscle isn't just like a big muscle. It's one that has flexibility and health to it as well. And so if we just have muscles that really aren't quite engaging, or we're having a hard time kind of getting in touch with them, it might not be helping us out in the way we want to during sexual function. And then during arousal. And then during orgasm, kind of automatically our sympathetic nervous system, so kind of like this unconscious, our brain is controlling, or our spinal cord is controlling a sympathetic nervous system response that triggers a reflexive wave of muscular contractions throughout your body. And your pelvic floor is included in this. So it can be, you kind of cue yourself, or can, in the moment, actively using your pelvic floor muscles on top of this may even intensify your orgasm.
Yeah. And we had some questions around this, like, in postpartum, like, how can you also think about this too, like specifically?
Yeah. What are you seeing in the postpartum period and the change in the sexual response, Dr. Jen?
It's so clinically and anecdotally, what I see is that there is a huge number of people who have issues. In fact, I want to say it's upwards of like 75%. There's an actual figure out there, but it's close to like 75% of people who within the first few months of resuming sex after having a child, and that doesn't matter how the pregnancy is delivered, vaginal or C-section, a lot of people have issues with this postpartum. One anecdote that I always love to throw out, because I think it really just sort of like turns the lens on a lot of systemic issues with our healthcare system, is comparing us to different countries. So like France, for example, they have something called a kine, which is like a pelvic floor physical therapist that is assigned to you postpartum. So for the first like 6 months postpartum, this is included and almost expected as part of your recovery. Doesn't matter how you delivered, doesn't matter what kind of tear you had or whether or not you're having incontinence. This is an expected part of the recovery because it's very common that these issues will arise. And I always joke that like French women don't pee themselves because it's like proactive and preemptive instead of reactionary. I once had a patient actually from France who we were talking about this, and she said, oh yeah, if you need to use a pessary, which is like a device we sometimes use to help with incontinence, you're already a lost cause. And it just, it like made me laugh because I'm like, wow, we are so behind with this. So I mean, that's a long way of saying it is incredibly, incredibly common.
Got it.
It's incredibly common for sure. But what's important to know is that talking about it or seeking help for it is going to also benefit you tremendously. Because while sexual dysfunction is common postpartum, it doesn't have to stay that way. And there are certain things that may be contributing to the dysfunction that you're feeling in the postpartum period, that once, we work through those things and kind of like discover this new and different and wonderful sexual function in the postpartum period. So it's not the end of pelvic floorgasms after baby, that is for sure. So how to make pelvic floorgasm happen? This is where kegels come in most of the time, or in lots of instances. This is the classic way how to learn how to use your pelvic floor. We've heard of a kegel, and this is essentially a pelvic floor muscle contraction and relaxation. So when you squeeze them, it's almost like you're trying to stop the flow of urine. You're kind of thinking that's the movement of that pelvic floor. You can also practice engaging these muscles by imagining that you're using them to pick up blueberry up with your vagina. It's hard to kind of conceptualize this movement in this area of your body if maybe there is dysfunction or you haven't really thought or needed to connect with it before. So cues like stopping a flow of urine or picking up a blueberry with your vagina, or if we're trying to kind of engage in sexual practice and sexual function, some sexier ways to kind of pick up on what this movement is, grab a vibrator or a toy, or use your partner's finger. After inserting it into the vagina or the anus, you can try and use those muscles. So you kind of have this, okay, I feel something's down there. Now I'm kind of using these muscles to squeeze around it. Or even when you're having penetrative sex, just try to use those muscles to kind of pull either the dildo or your partner's penis or whatever may be in deeper. That's that movement of that pelvic floor. It's kind of this pulling up and in movement.
Got it. I know we had some questions like around, and I love your take on this, Dr. Jen, just like around sort of the myths around penetrative sex to an orgasm with that. So like, we had one question that was like, is it true that 30% of women can't orgasm through penetration alone? And then, can it be changed with physical therapy? Like sort of, how do you think about that? I know like that was always I'm like, did I write this? But that was, I think those are big questions that we see a lot.
I think what we're learning a lot about just the whole, about sexual function in general, and specifically for women, or just not cisgender men, which is what a lot of research has been solely based on for decades and decades,
Totally.
is that it's really, really complex. And there is that, I mean, the answer is there's no one way to orgasm, but we're finding that a lot of orgasm starts or is, I guess, attributed to that complex innervation of the clitoris. In fact, it wasn't until relatively recently that we even knew, like that diagram you have of the clitoris. People used to think it was just sort of like the tip of the clitoris.
Okay, yeah.
It's
like the iceberg, like that iceberg
yeah,
image.
exactly.
Like it's all under here.
Right. We didn't even realize that it extended so far out and in both directions and back. And even this idea of like a G spot, for example, probably is part of the complex innervation of the clitoris. But I love this idea here of using a vibrator, using a toy, something, or even your partner in some way to increase that. I pulled out some props also. So I've got the Vibe here, the Maude Vibe in front of me. And so just so right on point with what you're talking about here, using some kind of sexual toy, sexual tool to help increase not only your ability to floorgasm, but just to have increased arousal, increased desire, and start that whole cycle is a fantastic idea. I think one of the things that we often don't talk about enough, just in like the traditional aspect of medicine, is how these tools can be really helpful to achieve sexual health, for sure. And that goes back to stigma, right? This whole area is very, very stigmatized. And if we can increase access and like we're doing today, just increase like the conversation about this, that automatically takes away some of the stigma and some of the mental hurdles that happen when we're trying to achieve orgasm.
Yeah, totally. And from a physical therapy perspective, Ashley, if people are coming in like sort of either having trouble orgasming or only orgasming through one sort of type of sex, how do you think about talking with a patient about that?
Well, Dr. Jen, you talk about those mental hurdles. It's such a huge component. We can't forget all. It's not just what's wrong with my body, which is what I think a lot of us kind of experience and feel when we are experiencing sexual dysfunction. Like, what's wrong with me? Why is my partner not doing it? Whatever it may be, it's all kind of like, the mental hurdles that you're talking about. It's so true. It's really, of course, there's a huge pelvic floor aspect in a lot of cases of sexual dysfunction, but it's not always the case. As a physical therapist, what I'm kind of looking for is the whole picture, what's going on, head to toe with this person, and what could be contributing. When it comes to that pelvic floor, though, I'm looking to see, are these muscles strong? Are they functioning in a way that would be generating good blood flow to the area and function? Or are these muscles tight and painful? The thought of, feeling like, you're being stabbed and trying to orgasm at the same time, there's such a disconnect there. But that tension in those muscles, the pain we're feeling, and then the stress that we're feeling about not having an orgasm, it's this like never-ending cycle. And so we really try and kind of go in and figure out, well, where can we work? How can we work on the muscles and kind of peel back the layers? And then what network of other healthcare professionals can we also bring in to kind of support your discovering of what could be contributing? Because it's never just a muscle, but there's always an emotional component or a guilt component, maybe how you were brought up, and the cultural influences that could be contributing to guilt and fear and all of those things. So it's a complex phenomenon. Orgasm is sexual function in general, and it doesn't need to be stigmatized either. We need to talk about it and bring in help, because there is a lot of us out there that are here to support you in kind of discovering what could be contributing to your symptoms. And if it's not me, I have a whole, back pocket of people that I know can help as well.
I like Ashley that you said that about it being like multifactorial. I think that's just clinically one of the hardest things that I find in bringing up in the office, because people will often just come with like a very concrete issue, like this is happening with my body, therefore I'm not having orgasm or pleasurable sex. For example, I just had a baby, or I'm going through menopause and I have low estrogen and my vagina is, more fragile than before, or whatever, like XYZ medical problem it is. But it's really hard to sort of have that larger conversation with people and say, well, exactly what you just said. How could you possibly, well, one, it's never just the muscles, right? Because it could be the muscles first, but then there's like a mental reaction that comes to that stigma because of the stigma, and the patriarchy and how you feel about what's happening with the muscles. Or, for example, maybe you were raised in a culture where you never say sex. What does that do to you mentally and emotionally, such that when you're ready to actually have sex, you can't get rid of that shame? And so it's really hard to have that broader conversation with people so that they realize this isn't just the muscles. Like, yes, maybe that's a component either primarily or as a reaction to whatever came first, but it's so complex.
Absolutely.
For sure. So, balancing your pelvic floor to minimize dysfunction. So why this matters? Well, desire, orgasm, and arousal, they're interdependent and they reinforce each other. It's complex, like we're talking about. A sexual dysfunction in your pelvic floor. It can be psychological, it can be physiological, emotional, and or relational. All of those life stages that you brought up, before pregnancy, fertility issues, postpartum, menopause. The pelvic floor muscles are necessary, though, for sexual response, especially in orgasm. I kind of talked about this a bit before. A weak pelvic floor might contribute to symptoms such as decreased vaginal sensation. Maybe you're not kind of feeling as much touch as you feel like you should, a decreased orgasmic response. Possibly there's even urinary incontinence during sex, which could be just kind of distracting, emotionally embarrassing, and something that could be turning down the arousal component in your head. But you might also have overactivity in those pelvic floor muscles, that kind of the tension or like overactivity, spasm, that can contribute to pain.
We had some questions around, like, if you had a hysterectomy, how can that kind of impact your interest, or like your body, your, I guess, like physical reaction to sex and orgasm? Any like kind of tips that you guys would think about around that?
Yeah, it's not something that's directly connected, but it's something that you definitely see happen sometimes. And it has to do, again, with the complexity of what Dr. Ashley was saying here. So like, what does having a hysterectomy mean to you? Does it mean the end of fertility? Does it mean is stigma associated with it? And then there's, that component of it. Is it potentially injury that happened during surgery? That could possibly be an issue also. But even when everything goes right, or if you're not feeling stigmatized about it, there's other confounding factors. Most people who have hysterectomies are at a point in their life when they're experiencing perimenopause anyway. So like, is that contributing also, or menopause? And then just this idea that if you think about like anatomically, when you're doing a hysterectomy and you're taking out someone's uterus, you aren't removing any of the tools that people need to have healthy sexual function. But if something else happens, if some other, infection or pain that persists or something else happens, secondarily, you can have a pelvic floor response that then causes pain, after that.
Yeah.
And sometimes, if there is a hysterectomy, maybe they are not removing the ovaries, but there could be fluctuations in the hormones that could contribute to drier tissue. So maybe you're having more like vaginal dryness that could be contributing. And sometimes I've seen scar tissue kind of developing depending on the surgical approach that can be irritating some of the nerves and the fascia in the area that could be kind of secondarily contributing to some of that pain or dysfunction that you're feeling. So a quick note on kegels. I love this. Yes, or GIF, whatever. They're great for some, but they're not so great for others. And we talked about the pain component. Remember, an overactive pelvic floor can lead to pain. Kegels benefit muscles that are deconditioned. They're underused, lengthened, inactive muscles that by increasing their strength and tone. But if you already have pelvic floor muscles that are so overactive, then trying to kind of continue squeezing and contracting them can make them more dysfunctional. And then that can contribute to the painful symptoms like the pain with penetration, maybe pain or cramping after sex, may hurt to kind of relax your pelvic floor muscles after intercourse as well. And you may also experience decreased arousal, orgasm, or desire because those muscles really just aren't able to contribute as well as they should.
I know that was my biggest like learning from working at Origin was like, I have an overactive pelvic floor and like, I shouldn't be doing kegels. And I'm like, that's the only thing I even knew about my pelvic floor before I worked here. So
yes.
That's
why we're doing this PSA, because there is more to it than pelvic floor contractions for sure. You need to balance your pelvic floor. Oh, go ahead, Dr.
That's one thing I always love to admit to, and I feel like this is helpful for a lot of people, is that I, as an OBGYN, I'm a gynecologist, and it wasn't until giving birth up to my first daughter that I learned how to do a Kegel the right way from a pelvic floor PT.
So common though. The large majority of us, I mean, just reading about it or kind of hearing what you're supposed to do, it's like what I was saying. If things are going well, you're not necessarily thinking about engaging and using this. I'm walking, and so I'm using these muscles. But when it's only in dysfunction, when we start to realize that, oh, gosh, now I need to kind of do something about it. And engaging that area of your body is not intuitive. And until I went to these courses, the continuing education courses myself, and was forced to learn it, I wasn't either. And I was like, I thought I was super in tune with my body. I'm an athlete, and I went to PT school. I learned all about these muscles. It's not that intuitive. So if you're feeling like you can't connect, that's so common. And we're here to help. But balancing that is the key. We want strong pelvic floor muscles that can protect against leakage, support your organs in the postpartum, before, while you're exercising, while you're jumping, while you're laughing, and encourage blood flow to the area. But they also need to be flexible and have a pain-free range of motion and ability to stretch. That gives it the most power of muscle contraction anyways. A muscle that has this ability to generate a contraction has length as well as contraction. And then we want them coordinated. We want them to contract and release at the right time. That would be they contract when you sneeze, or they contract during orgasm, or they release when you sit down to empty your bladder, or release when you sit down to have a bowel movement. A balanced pelvic floor supports blood flow. It helps to support the nerve function and overall pleasure during intercourse.
Yeah, to that question on coordination, I know we had someone ask about like, how do you strengthen your pelvic floor when you don't feel like you have voluntary control over it? Like, how would you start to think about that?
That's a great question. It always depends, of course. Every person is an individual, and there's all sorts of different reasons why someone might not be able to connect with that area of their body. That can be complex as well. Was there trauma? Are you kind of disconnecting from that area of your body for certain reasons? Or is that muscle just so underactive and hard to connect with because there's really not much function going on down there? The best place to start, oftentimes, kind of the majority of the time, is teaching you how to isolate that muscle in your body, identifying where it is, so kind of learning about that muscle, where it connects, what its function and role is. And then having someone kind of teach you the movement. So seeing a pelvic floor physical therapist and being able to kind of show you the exact movement, touch the muscle, show you on a model, do all of the things, teach you how to engage those muscles, use fancy biofeedback even. Just being able to identify and isolate that muscle can be one of the best ways to start reconnecting and getting it to function again. All right, my face is in the way of this slide here. But so what is going on? Is my pelvic floor out of whack? So you're thinking, okay, so I have pelvic floor muscles. Now I know what my pelvic floor muscles are. I know how that they're working, how they're supposed to work in orgasm. But what's going on? Is my pelvic floor functioning well? These are some kind of signs and symptoms that you might be kind of looking for that might lend to, I might be thinking my muscles might be underactive or they might be overactive. It's more common to have lower tone or underactivity after childbirth. symptoms or diagnoses like pelvic organ prolapse or stress urinary incontinence are quite common, even fecal incontinence. After childbirth, after pregnancy, I say that because I think oftentimes we think that just a vaginal delivery is the only thing that's going to increase your risk for having a pelvic floor muscle dysfunction. But pregnancy is a giant risk factor. I mean, you're pregnant for 9 months and that puts your pelvic floor through a lot. So even after cesarean delivery, we see pelvic floor muscle dysfunction. Surgery or injury to the area, maybe it affects the nerves, the integrity of the muscles can contribute to low tone, pelvic organ prolapse, like I touched on, or the bowel and bladder incontinence. And then when we see overactivity, it's more common to have like trauma or injury to those tissues or muscles. Maybe you have a lot of stress, kind of tension holding in that area. You kind of think about like TMJ, tension in your chronic headache, tension in your shoulders, holding your breath. Your pelvic floor muscles are often one of those areas of our body where we hold tension. You might also experience bowel and bladder issues if you have overactivity as well, but it might present more like urgency or frequency, where you're running to the bathroom more often. Or you might even find kind of like hypermobility in your joints if those muscles are so tight that they're not stabilizing like you need to. You might also see some conditions such as PCOS, endometriosis, fibroids, or interstitial cystitis. They're very common to also, when we have these pelvic diagnoses, to also see pelvic floor muscle dysfunction. What is your experience, Dr. Jen, in kind of that cross of those pelvic pain conditions?
Yeah, I think it goes back to what you were saying before, where whether it regards to sex or in regards to bowel or bladder control or regards to how you're feeling postmenopausal, it's never just the muscles. And so it's very rare to see any GYN scenario in isolation without involving the pelvic floor. So very frequently with people who have chronic pain like endometriosis or fibroids or IC, over time, if it doesn't happen right away, at least they're going to develop some kind of reaction, like their pelvic floor is going to respond. And it makes sense if you think about, like you were giving those examples of TMJ, like if you've got an area of pain, of inflammation, maybe even chronic infection, of course, the tissue around it eventually with time is going to start to respond like, hey, this is not cool. I keep hurting down here. So the pelvic floor eventually is going to be an issue also, even if it didn't happen first, if it was just like secondary to those things.
So then now what? If we're looking at the pelvic floor that's more on that overactive side of things, we really work on teaching that muscle how to relax, release, give it back its range of motion. We also really want to teach that pelvic floor muscle area that the only outcome of stretch doesn't have to be pain. It's kind of retraining that central nervous system that this can be a pain-free zone. Some common exercises you might see, a butterfly pose where you're just kind of releasing your inner thighs outwards in like that diamond shape to kind of help contribute to calming down of the whole area, your pelvic floor, your inner thighs, your glutes, your abdomen. Child's pose. This will help to open up the back of your spine, your pelvic floor. It allows your tailbone to lift. Squats will also help to lengthen and open the hips and pelvic floor. And then diaphragmatic breathing is kind of one of the most effective, helpful tools for everybody that helps to kind of gently move your pelvic floor, your abdomen, your diaphragm in this kind of rhythmic movement position, which is most of the time pain-free as well. So it's like this place to start to help calm the nervous system down and teach your pelvic floor muscle how to move again. Pain-free. And then strengthening. If that is we're on the underactivity side of the spectrum, that is a good place for those Kegel exercises to help strengthen your pelvic floor. Just remembering it's not just about contracting, but also about relaxing and releasing. Kegel weights can be added as well. These are little weights that can be inserted into the vagina. They really help to kind of improve your awareness to that area. And it's almost like, resistance training for the pelvic floor. Yoga can also be really helpful for strengthening. It's really helpful for calming down an overactive pelvic floor, but also helpful in strengthening. Kind of focusing on maybe moves that maybe power up your core, such as planks, warrior poses, things like that. And then again, that diaphragmatic breathing. If you're having a hard time connecting with that pelvic floor and how is it moving, diaphragmatic breathing can be a wonderful place to start. So Dr. Jen, I love your take on this component to the building of your orgasm toolbox. Yes.
But yeah, I've literally got it right here. I pulled out like all the props, including my Maude stuff, including even like the kegel. Yeah.
For one of my PTs like helped develop that.
Yeah, it's amazing. I really like, I mean, I can tell you just in general about this particular device, the Vibe, and then the Drop, which is the rounder one. I didn't have it with me today. Basically, the idea with Maude is that we're increasing access and availability of these tools in a stigma-free zone to everyone, all body types. And that's why you see that a lot of the products are, you know, neutral colors, and they don't look like that fancy pink bright rabbit that, you know, subtly, not so subtly, maybe does increase stigma. People don't want to go out and buy that. It says certain things about them. But however you're doing that, you know, whether it's Maude or another device, another tool, like, please, all power to you, because again, what we're trying to do is increase your ability to achieve arousal or desire, arousal, orgasm, all parts of what we traditionally call the sexual cycle. And these are absolutely helpful tools to help you get to that place, whether it's starting the floorgasm as we've been talking about, or just using this just for pleasure. This is an excellent way to really start to increase your sexual wellness. Also on a slide, you can see there's a couple of different resources here, websites. I love OMG Yes.
Best.
Yeah.
OMG Yes, it's the best.
This is you said earlier that you give the Vibe as gifts. Absolutely.
I gave this to all the women in my family for Christmas
OMG Yes
years
too.
ago.
I always gift the Vibe, and I always gift OMG Yes, which by the way is like $40. It's an excellent gift. Yeah. But as I tell patients all the time, a lot of what we understand about sexual health and wellness comes from literally like decades old research, like Masters and Johnson's from like the 1960s. OMG Yes is sort of revolutionizing that. And again, I have no connection with them, but it's basically trying to understand sexual wellness and desire and the cycle from a non-linear or even non-traditional circular approach, like we've always thought about it, but really getting creative and understanding how do women feel pleasure, and how do we know unless we ask them? So they've literally interviewed thousands and thousands of people to get this data.
Yeah, I'm a big fan of Dipsy and Rosie too, for like kind of audio erotica. Just
amazing too. It's think of it as the Audible for like erotic stories. But again,
what sexy podcast.
A story with Dipsy, like these are all tools to help you destigmatize and start this process so that you can start to peel away parts of this very complex hurdle for a lot of people, right? A lot of it is mental, and then like we were saying too, secondarily, a lot of it becomes your pelvic floor.
Yeah, absolutely. Well, I know we still have a couple of questions, so I can kick some of those off, but if people who are listening in have questions, feel free to drop them in the chat or the Q&A. I know, just like kind of continuing this sort of orgasm train of thought, there was a question around like, how can you roll a lot of like micro pelvic floorgasms into like a bigger orgasm? So I'd be curious for either of your take on like how to build to that big moment.
I'll bounce this one to Dr. Ashley.
Okay, yeah. I mean, it's always kind of about, well, what are those little mini orgasms? Could it be that are we having, trouble getting those muscles to kind of increase the blood flow to that area? Or are those muscles not relaxing and releasing like they should to help allow the blood flow that it needs to? So it kind of really just depends. Is it that we need to be able to kind of roll them over, or do we need to kind of work on, helping those muscles function more optimally to see what, if the mini orgasms are just a component of a muscle that is not quite working so well?
Got it. We had a question around like, Ashley, can you talk a little bit more about the diaphragmatic breathing and how to like best practice that? Like what sort of how you go about that?
Yeah. So diaphragmatic breathing, it's like, there's so many different ways to breathe, and you never really think about it like, am I breathing the right way? Diaphragmatic breathing is really kind of describing using your diaphragm. So the respiratory diaphragm that sits at the bottom of your rib cage, underneath your lungs, it expands down into your abdominal cavity in order to allow that space for your lungs to expand with air. But oftentimes there's so many ways that we like make up different ways to breathe for many reasons. Maybe in pregnancy, we don't have full access to our diaphragm, and so we breathe more with our upper chest. Maybe we have stress and we start kind of using our accessory respiratory muscles to help us breathe. And we lose that kind of beautiful big belly breathing like we see in infants, that just kind of that expansion of the abdomen. Diaphragmatic breathing kind of really dials back into that natural diaphragm movement. That allows, when our diaphragm expands into our abdominal cavity, our abdominals and our pelvic floor release to allow that expansion. Our abdominals and our pelvic floor will compress our abdominal and pelvic viscera when we contract them, or kind of lift and compress them. If we're breathing and also trying to allow movement into the abdominal cavity, then those pelvic floor muscles in the abdomen need to release and relax so that there isn't an increased pressure in your abdomen. So there's this natural movement of the pelvic floor when we breathe properly with our diaphragm that helps it to extend and then contract back up. So when we kind of talk about diaphragmatic breathing, it's really inhaling in that proper way, using your diaphragm to expand and contract your abdomen and your pelvic floor, kind of teaching you to feel it down, what's your abdomen doing, what's your pelvic floor doing, and then teaching you to kind of go with the movement. Use your pelvic floor muscles a little bit more actively with the breath to build on its function. It's going to be really helpful, but it also calms down the central nervous system. It's so good for your body for so many reasons.
Yeah, we had another question around, and I know we had a question ahead of time about this too, like what's the difference between like peeing your pants or urinary incontinence versus squirting during sex? Is that urine, like what's going on? What is it? Like, what is that actual like chemical, physical reaction? And sort of how do you differentiate?
Dr. Jen, I would love to hear this from you.
People ask this a lot, and unfortunately there's just,
I'm always like, everyone's always like squirting. Well, like, is it real? Is it fake news? What's the deal?
I think it's like, it's part of this, there's definitely a blur between like a lot of medical entities and just like societal or cultural entities, right? Because sex isn't just medicine and physiology, it's a cultural phenomenon. And so squirting, there isn't a lot, unfortunately, of data, like the data that we typically
hard medical data
about squirting.
There aren't a lot of peer-reviewed studies around squirting.
Like a randomized control trial on squirt. No, sorry, this person, I want to point out, they said, sorry if inappropriate. Nothing is inappropriate. No, absolutely not. And I always say in the office too, like, please, like, if not there, where are you able to get these questions answered?
Yeah.
But I mean, the best that we understand it is probably that contraction response that you were just talking about, and a little bit of urine leaking out. Some people have more or less control over that, but again, it's not something that's really well understood beyond that.
From like a what is it made up of? Is it like just a fluid, or is it urine?
There's a little bit of everything, is what they think. They think it's a little bit of urine, a little bit of like lubrication, natural lubrication that's happening at the same time. The body of literature is not that robust into looking into it.
Fascinating.
And there can also be urinary leakage that maybe, even if it's aside from, if there is the squirting, urinary leakage can occur in absence of orgasm, right? If you're maybe not engaging the muscles at the right time, or if the organs themselves aren't supported properly, there can be leakage that can occur during sex, and it happens. It's common. It's one of those things, like I said, that can contribute to some of that emotional distraction that can contribute to sexual dysfunction.
Great. We had a question on, is there a different neuromuscular response between a clitoral orgasm versus a G-spot orgasm, or how are those differentiated?
Yeah, I mean, Dr. Jen, you touched on that before. It's a complex area, and it's really hard to kind of tease out where specifically something is coming from.
Yeah, I would say too, there's a neurovascular difference between person to person too, right? I mean, we have different anatomy. There's different things that affect the nerves and your ability to orgasm in that area. So that's a hard question to answer, because you can't say like across the board that this kind of orgasm, if you're penetrated on this part of your clitoral nerve root ending or nerve endings, it's going to feel different from this part, and how that feels from person to person. It's really hard to answer.
Got it. We had another question was about around like bloating during and after sex. Like, is that normal? Is that like, could that be related to like arousal or anything else that's going on? Or what, how would you help that person kind of think about that piece? Maybe the answer is like, you should probably talk to your provider, but
Yeah. To be honest, I don't know. I don't know what that would, it hasn't really been something that I have seen kind of clinically, and really as it relates to pelvic floor muscle function. That would be something that if that is something that someone's experiencing, absolutely checking in with your physician, what could be contributing to that would be a great step to start with.
Yeah, I agree. It's not something necessarily that we hear a lot about. And I wonder if it has a little bit to do with just the swelling that happens in that area in general, but like abdominal bloating, not usually something that we see.
Great. And then I think one kind of last question is really around hip tightness and like how that could be impacting orgasm. Like, is that, I know we talked about like butterfly is a great stretch, but like if you are experiencing hip tightness, can that impact your orgasm or sort of your ability to orgasm there?
Well, for sure. I mean, there are a couple of reasons of why a hip might be tight or feel tight. So our glutes, so our butt muscles and our pelvic floor are really complementary to each other, and they support each other. Like a strong glute and strong pelvic floor go hand in hand. A lot of times when we have tightness in our hip muscles or in our glutes more specifically, it's almost compensatory for a weakness in a pelvic floor. So oftentimes if we can balance the two muscle activities, so increasing strength in that pelvic floor kind of takes the load off of the glutes that could be contributing to that overactivity, that overuse. So if there is that underactivity present, that could be contributing. But also tight hips, it might be that those hips themselves, those muscles are feeling tight, but they're kind of masquerading as tight muscles, but they're actually weak. And so we're needing to strengthen a muscle. We stretch till the cows come home, but it never stops feeling tight. Those might be more muscles that we need to strengthen and balance to kind of improve pelvic health in general.
Great. Well, I think that is all the questions that we have. Really appreciate both of your time. Dr. Jen, if you want to find more about Maude, what's the best way to connect with you all?
Yeah, so we're on all the socials. The website is getmaude.com. And lots of stuff coming out all the time.